212 Choices, 212 Choices for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212 Choices, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. We're stuck in the Good News Department, which is a great place to be. The Good News Department at Radiosurgery New York. And guess who we saw this week? A woman with kidney cancer. So you say, wow, kidney cancer, it's a bad one. Yeah, that's right. Kidney cancer. She's about 70 and treated her 12 years ago. 12 years ago. For kidney cancer. She was seen by surgeons. She was told she has to have surgery, has to have it. Well, she didn't have it. She didn't want to have it. She didn't want to have cutting, bleeding, hospital stay, and all the complications. She came to us, had 5 treatments, stereotactic body radiosurgery. We're first in America to offer this technology, have lots of experience. It's a big difference, years of experience. We have radiosurgery experience dating back to 1986. She came to us, treated that cancer in the kidney, and for 12 years, she's still in remission. Doing great, no activity, cancer's dead, she is alive, and that's what it's all about. She's fully functional. She loves to tell her friends and family about us. She loves the results. She loves the fact she had no cutting. She loves the fact that she had her kidney left intact, that we're able to focus on only the cancer and leave her body intact, fully functional, no dialysis, fully functional, cancer's gone. So that's from our Good News Department. And there's another man. People are crowding out the Good News Department, which is what we want. Here's a man who came to us. He's about 70. He went to another facility, and he was pushed, I believe, into having cryotherapy for primary treatment of the prostate. Well, most people wouldn't do that. Most people don't believe cryotherapy should be the primary treatment because there's just not the data and long-term results. So he had cryotherapy not once, but twice. And during that period of time, at a big hospital, a famous hospital, a top-notch hospital, his PSA went from 9 all the way up to 30. So not only did he have complications, his sex life stopped after cryo. He started leaking urine, so he lost urinary control. He became incontinent of urine, impotent, and the PSA went from 9 to 30. Wow. Exactly what he didn't want. Complications without results. He came to us last year with all those things, and we showed him our data. He was a high-risk man, obviously, with PSA 30. He was high risk. Got treated with our premium product for prostate cancer, which is brachytherapy by us, and treatment in the stereotactic frame. And we have data to show you, which is so important. You can call in and get the booklet for prostate cancer. If you call our office at 212-CHOICES, 212-246-4237, 212-246-4237. We'll show you the booklet. So what happened to this man? Well, he came in this week, and he's in the Good News Department. His PSA has dropped by 70%. It's down to the single digits after treatment. No hormones. He refused hormones. He didn't want to have all the complications of hormones. He had our treatment. Was done in half the time of usual radiation with better results, even though he's high-risk cancer. So fantastic for him, fantastic for him, fantastic for the son that came with him, and, of course, we wish him well. Now, there's another news article this week, and we like news that helps your life and news that you can actually implement. And this was from USA Today. And the source is a report from the United States Preventive Health Task Force. And it shows that most vitamins and mineral supplements, alone or in combination, have not been proved to help, are hurt. They actually hurt when it comes to preventing cancer and heart disease. This is a new report from the United States Preventive Services Task Force. Now, consumers should not take, they say, beta-carotene or vitamin E to prevent heart disease or cancer because vitamin E does not work, and beta-carotene increases the risk for lung cancer in people at high risk for the disease. Now, this article is going to be published in the Annals of Internal Medicine, which is one of the major medical journals in this country. It doesn't say that consumers are wasting $28 billion a year that they're spending on multivitamins and dietary supplements. And it doesn't say what the vitamin industry is doing to get people to take these medicines. Now, it doesn't talk about vitamins for specific reasons, like for pregnancy or for diagnosed vitamin deficiency. So some people need vitamins, pregnant women, or people with known vitamin deficiency, but we're not talking about those people. We're talking about people that are lured into drug stores, vitamin stores, and are being sold vitamins that are supposedly extending life, where actually it is shortening life. In case of beta-carotene, there's been harm. Studies show it increases rate of lung cancer in smokers and others at high risk. It's also known that vitamin A can be toxic. Studies have led researchers to scrutinize other supplements. So it's important for you to know that those vitamins that you think are innocuous can actually be harmful and actually take away years of life. So we're not against anything. We're for the data. And show us the data. I know some people hold the vitamins very close to their heart. That's fine. But show us the data. We don't want you to spend your money and have your life shortened. So show us the data. Just show us the data. I'm showing you our data. I'm giving you the reference. If you have any questions, you're welcome to call us in, and we'll talk more about it. But this is the data of thousands of patients studied, and it's not the first data. So please, give us a call and talk about it. Call them during the week. But these vitamins are not cancer treatment. We have some new patients here I want to talk about, some more new patients. We have a gentleman who came to us. He's a 71-year-old Hispanic man from Dominican Republic. He had a PSA of 8. PSA is the blood test. He had a Gleason 6 cancer. He is having a lot of symptoms, urinating all night. He has a massive prostate when I examined him. He even stops drinking liquids after 7 p.m. because he urinates so much every night, and still he urinates 4, 5, 6 times a night. So he's on medicine. We're going to check his PSA. When we checked it this week, it actually went from 8 to 15. So he went from a low-risk cancer to an intermediate-risk cancer. If you look at our data, and our data is in our prostate booklet, I can show you what page exactly to look at people with Gleason 6, PSA between 10 and 20. You can see that with us, the success rate, meaning no cancer, 5 years later is 90%. With radiation, 9 weeks, or surgery, it's about 60%. So why would this gentleman come to us? Because we can increase the chance of being cancer-free by 50%. And with our patients, most all are intact with their urinary control, and most patients are sexually functional. They avoid the cutting and bleeding of radical surgery. They avoid the prolonged course of treatment, and we have the data. We have the data to back up what we say. So give us a call if you like the booklet. We're in our office, 212-CHOICES. Call us during the week, or the best is actually make an appointment. We sit down, we spend a while, an hour, 2 hours, whatever it takes to go through everything to make sure that you understand all your options and what's doing how you get to the best point that you want to be, which is healthy, cancer-free, with your body intact. Now, we have another patient who came in. He has a prostate cancer, PSA 7.9, Gleason 6. He's never had treatment. He was seen by the director of the department at a big hospital. He's had no scans, no bone scans, no reports. He says his doctors never even took time to speak to him about treatment. He's urinating 3 times a night. He's on Flomax. He also doesn't drink at nighttime. And he has some pain in the buttock area. So he has pain. He has cancer. We're going to check him out. We're going to see why he has that pain. On physical exam, instead of having a walnut-sized prostate, he has a prostate bigger than a plum. Gleason 6, which is the most common prostate cancer pathology. Pathology means a biopsy was done and the slides were looked at by a pathologist, so he definitely has cancer, definitely has elevated PSA, and we think there's a great chance of remission. We believe that there's a great chance in shrinking down that prostate and getting him into complete control. So again, we have a unique prostate cancer program, avoiding radical surgery, avoiding prolonged course of treatment, avoiding those daily CAT scans, which some other technologies require. No, ours is non-invasive. So we're going to go to a word from our sponsor. Again, if you have questions, call us at 1-800-848-9222. 1-800-848-9222. We're live in the WABC studios here in Manhattan. And here is that man. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES. 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back, and back with some good news, more good news. There's a report this week that showed that women with BRCA gene, so the BRCA gene is a familial gene, BRCA1 and BRCA2, and it's linked to a variety of cancers, mainly, not only, breast cancer and ovarian cancer in women, and also breast cancer in men and prostate cancer in men. So people don't talk about it, but there are implications to the man also. So this study looked at removing the ovaries and how it affects the chance of developing ovarian